Hello, it's Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VetChat, the UK's #1 veterinary podcast. And I'm very honoured to have on the line Ben Sweeney, who is the founder of VidiVet, but perhaps even more importantly, the founder of VetChat, because of course, while you were working together with us, that you actually started the podcast, we chatted about it, and you were the guy who got it moving all those years ago.
Yeah, it's quite weird being on the other side of the microphone, but it's it's nice. Well, it's nice to see it still going so strong and obviously gaining such a following and reputation, which is nice. And to be perfectly honest, it's quite nice seeing like some really cool things that people are discussing over it. So, shock horror, I listen to it on a regular basis.
Oh, no. Well, great to see you, Ben. And obviously, I'm not sure when this will go out, but we're sitting here on a Wednesday morning, late January, trying to get ourselves organised to get down to Spiv's conference later on in the day.
Yeah, it's there's nothing quite like a 60-mile-an-hour windy day to be driving down the M6. But it's always, I find Spivs is a really good like sort of kick start to the UK. Obviously, some people will have already been across at VMX in the States, but like for the UK scene, like Spivs is always my like early year tonic, almost like, you get that touch point with your existing clients, but also like, all of these new exciting businesses that are popping up and new partners, and whether that's an established business. And of course, this year there's so many new independents that are setting up and establishing, and Spivs has, of course, really supported them traditionally, and hopefully moving forwards in future as well. Be an exciting few days, I think, and I'll be looking forward to a lie down on Saturday afternoon.
And obviously, used to be down at Celtic Manor, which I always used to enjoy the drive, but Birmingham is that little bit closer for us in Liverpool, isn't it?
Yeah, well, yeah, there was nothing quite like the epic trip to Celtic Manor, but it was quite nice when you pulled under the pillars and somebody said, "Can I take your bags for you?" But I think, as with many things in the modern era, like they move forward, they evolve, and there's a new manifestation. Obviously, last year was the first year of the new venue, and I have to say I was really impressed with the events. Like lots of good quality talks, lots of good quality speakers, and let's be honest, there was a fairly good social crack as well. So it's always good fun to have a part of that for the end of January to kickstart the year.
And of course, a lot of change going on in the veterinary profession. I was at VMX and a lot of stands talking about AI, technology, digitalization. VidiVet, obviously at the forefront of that with the telemedicine offering that you are, that you brought forward. So tell us a little bit about VidiVet and how that's going.
Yeah, I mean, kind of VidiVet was essentially born out of a frustration, as many things are, not just with our profession, but globally. And I still remember very, very vividly a client coming into me who had a 9-year-old German Shepherd. And the dog had been losing weight for a period of time. She'd gone on Facebook, she'd spoken to the breeder, she'd spoken to everybody except the flipping vet. And they, I'll give him a high protein food, give him this. Dog came in, you have a feel of the abdomen and go, yeah, there's a nice big mass there.
Mm.
And 3 months has passed in that period of time, and of course, a tumor has progressed, and sadly, in that case, whilst there was short-term recovery post-operation, the dog died shortly afterwards, and like for me, that was just kind of a primary example of how people were going elsewhere for information rather than coming to the vet. Like, you cast your mind back to the 90s, the vet was the source of information. That was it.
Yeah.
And that was it. Now people are looking at the convenience elements. And interestingly, like we interviewed so many people as part of the sort of discovery process. What fascinated me the most was how many people were actually, they were palpably aware that they didn't want to bother the vet. They didn't think it was important enough to take up the vet time. They actually, much as though I think we sometimes don't think this, they were aware of the plight of veterinary surgeons and didn't want to add to that burden. So we ended up interviewing a load of them. We said, well, look, why do you do these behaviors? And it's the convenience. It's that sort of, I do this because of that. But we launched this, of course, in the aftermath of that first wave of telehealth platforms. And always our concern, and my personal concern with this was, look, a lot of these services are disintermediating the practices and
Mm.
cutting them out of the loop. And as is quite rightly every practice is concerned, challenging revenues and advice and sort of that. So for me, that there was a way that we had to use telehealth as a part of that practice journey to keep the practice at the epicenter, but to deliver kind of Google-esque um, availability of veterinary expertise for the client. Because understandably, they phone a practice, they speak to reception, and reception say the vet will phone you back. We all know what it's like in clinic. So,
Mm.
12 hours later, when you've not stopped all day and you get a chance to phone them back, they're a little miffed, and that's not your fault.
Mm.
So we're like, well, okay, how can we use this army of vets globally? We've got so many UK MRCVS vets that have decided to move for, as I look out the window now, for some unknown reason, to warmer climates, and go, well, I've got this wealth of expertise and knowledge, and they have this drive to want to use it to help their colleagues on the front line. So it was like, how can we
Mm.
harness that in a platform that keeps the practice central but delivers exceptional customer experience? So it's kind of like, yeah, no pressure. We can deliver that in as short a time frame as
Mm.
possible. Great, and we were very lucky to get our first break with a practice called VidiVet over Grantham Way. So Case Bennett there came to us and was like, really like the idea of what you're doing. I'd like to use it in my practice, and that was very much our pilot. Very quickly followed with the likes of Powys Vets, animal doctors in South Wales, and Village Vets in Formby, and they kind of gave us our chance to prove our worth to clinics. And you need that. You need those early adopters to
Yeah.
say, look, we've got a problem. We are closed out of hours. There's more than half of our week where we don't have the capability to speak to our clients. What can we do together? And that was really our first break, and it's kind of
Mm.
snowballed.
And I think you were saying, you want Google-esque um, availability, but of course we want better quality than Google because, as you said, Dr. Google
Yeah.
is definitely a source of information for people, and sometimes it's just wrong, isn't it?
Yeah, and that's it. And kind of the way we phrase it is we put personalized, informed veterinary expertise
Mm.
at the same level of convenience as a Google search. So when somebody, when your clients as a practice send us a question, they can send us photos, video, text, and every combination of the lot to do with any case at any time of day, and they receive a personalized video response from a vet with a minimum of 5 years experience in an average of less than 5 minutes. And
Mm.
that, we aren't here to sell people stuff. We aren't here to say to people, look, we want you to use this and that. That is the job of the veterinary surgeon in clinic. And
Mm.
that was one of the biggest issues with other services
Mm.
was, upselling and selling other things. Like, we want our vets to purely triage, advice, and inform,
Mm.
and be that top of funnel for your clinic. So when cases come in, you know that you're seeing cases that truly need to be there, but actually they might turn up with a fecal sample or a urine sample. We've all been in that consult where we send someone home to get something and you never get the sample back, or they turn up and they want bloods, they want imaging, because actually that seed has been planted. What we don't do is turn around and say, right, oh yeah, we think he needs a T4 TSH. We go, your vet might want to discuss some bloods with you.
Mm.
All about that, what we've called the pre-vet journey, that thing that we all wish clients knew before they came into our consult room. So they're calmer, they're more focused, they understand a bit more of the process. So it improves our efficiency in the consult. But also, frankly, we're not seeing cases that aren't revenue generating or that, take up time and bandwidth that mean our
Mm.
vets aren't getting a break. We know that out of hours, over 90% of the questions that we get asked out of hours don't need to go into the emergency vets. And that
Yeah.
works for everybody, because it means you've not got an overworked emergency team that are dealing with 10 cases that actually could wait till tomorrow for a jab of Metacam. Other NSAIDs are available, and indeed monoclonals nowadays. But there's that availability, but actually enhancing the customer experience when they go, oh, great, okay, I've got peace of mind. I know I don't need to go to the emergency vets. I can pop into my normal vet tomorrow and see the vet that I know, and my
Yeah.
dog goes into an environment when they're less stressed, and I'm not panicking trying to find the place in the middle of the night that's an hour away. So really, we feel it caters to everybody. It keeps the practice at the center. It delivers an exceptional customer experience without putting the in-house team under additional pressure. Um, and it serves the out of hours teams as well, because it means they can focus on the cases that truly need their care. But again, I'm a little bit biased.
But I was going to say, Ben, when I kind of started that whole digitalization journey in 2010, and I spoke to Vet similarly and said, what's your biggest frustration? It was one of them, top three would have definitely been, it's really difficult to get your education. We have to go off and travel, either at the end of an evening surgery or for a few days. It's incredibly expensive. A lot of the traditional companies were charging a lot for training. When I started Webinar Vet, I reckoned it cost me £5,000 to do my training. Move forward 15 years, and you can pretty much, if you want to, get all your training online for free. Obviously, quality wise, you want to make sure you're going and looking at the top quality stuff. But moving forward 10 years, almost to the beginning or just before the pandemic, when I was ringing vets up, they were saying, what's your biggest problem? They weren't saying there's not enough online education, because, of course, by that stage, other people had come into the market. And actually, what they were saying was, I have a 5-vet practice and I only have 3 vets in it.
Yeah.
And one of the answers is obviously, well, let's find you 2 vets. But actually, the other answer is, well, let's, actually uplift the veterinary technician or the veterinary nurse. You can tell I've just been to America, can't you? So uplift the technician and the nurse, but also what can we do digitally? So, over that time, we've had tools like VETchat come out, iRecall, to be able to use those to free up time, because these things are automated. But similarly, as you've said, if you've got somebody in the background triaging for you and telling you, actually, you don't need to come into the practice, or you absolutely do need, you should end up with more time. And so maybe the more tricky answer to the question is, well, how can you actually run a 5-vet practice with 3 vets and run it really efficiently and with greater productivity and probably greater profit? And this is where I think services like yours really fit into that equation.
I think the buzzword in practice, or the buzz terminology in practice at the moment, is operational efficiency, and quite
Yeah.
rightly so. As a profession, we have traditionally had an awful lot of waste. And I think we look at stuff and go, well, I don't have time to do this, and invariably we do have time to do things. We just don't do everything efficiently enough
Mm.
to go, "Look, I need to do this, and this better,
Yeah.
or more efficiently." And I think, when you look at, the business case for these things, obviously we charge based on the size of the practice, the number of client base, and so on and so forth. Whereas actually employing somebody is quite a significant expense, especially with enough expertise to, deliver on as an educated veterinary nurse, as a veterinary surgeon. They're quite a high expense. Even an additional receptionist nowadays, you're looking at potentially an expense of a couple of grand a month. Um,
Mm.
and I think it's looking at kind of going, not just having more bodies, but using the bodies we have better, and looking after them more by a system. You've alluded to the likes of Pets App, I Recall, Digital Practice, another great one. You think, actually, when you can WhatsApp somebody their bill, save your receptionist spending 10 minutes on the phone. A great
Mm.
opportunity to, and let's face it, as a client, I'm much more inclined to click on a link and just go, right, yeah, I'll pay that now, job done.
Yeah.
It's a really interesting thing, and it's where this asynchronous communication has really come to the fore. In a sad way, for many things, we're becoming a disjointed society, and that boils down to the convenience. But equally, by doing the things that are convenient and necessary in a much more operationally efficient manner, allows us to do the things that truly require that face-to-face personal touch point, and intimacy better and more efficiently, and deliver that accept. So by having all of these tools that cater to the clinic and to the client base and to the team, it means that those critical points, that euthanasia that takes half an hour rather than 20 minutes, doesn't derail your entire day.
Mm.
And I think that's where there is huge opportunity for our profession, to do the stuff that really requires us to be
Yeah.
personal and intimate really well, and that is what sets us apart. You look at all of these digital businesses, digital can only ever, in my mind, augment physical veterinary services.
Mm,
Like, you cannot replace that feeling. And, again, any of us as clinicians have been in that room where the hairs on the back of your neck stand up for good and bad reasons.
mm,
And I think for me, like, being an additional arm that allows people to get that great thing out of being a vet and being a vet nurse and being part of a veterinary team is just so, well, frankly, it's humbling, because you sit there thinking, you're an element of something that enables people to do what we do best brilliantly,
mm.
and that's the bit that the client remembers.
I remember, I was talking about certainly 5 to 10 years ago about every business needs to be a digital business, be it a butcher, baker, candlestick maker, or a veterinary surgery. And in fact, I remember Brendan Burchard, who's a famous internet marketer, talking about use digital tools. The more digital tools you can use, the better, because a lot of these tasks that digital tools are doing are frankly boring.
Hmm.
And what we're very good at, and I know you were mentioning it in the VBJ recently, is, and I think, whether AI comes in and all the digital tools that come in, as far as I'm aware, no computer can empathize. And actually, we need those skills. We need to have the time, as you've said, to be able to do those skills. And I think the other side was all of that kind of me talking about being a digital business. In a sense, kind of I wasn't that persuasive. But I tell you what, the little tiny coronavirus was very persuasive. And I think that has helped, you and your business, because 5 years ago, or 4 years ago, when the pandemic started, and people were saying to me, have you heard of Zoom? And I said, well, we've been using it for about 6 years. Now everybody knows what Zoom is. Now everybody's very happy to do,
Yeah.
a Zoom call, either as a client or business to business. So that digital transformation has happened as a kind of silver lining of the COVID pandemic, hasn't it?
Yeah, and I think, for us, COVID was really when we started speaking to practices, they were like, well, we're doing this in-house ourselves and we really hate it. So actually, COVID was initially a bit of a barrier because practices had gone, well, look, video stuff, all of this stuff is, it doesn't work in practice.
Yeah,
And I vehemently agree, because actually, when you're trying to do that alongside doing all of your clinical stuff, it's
yeah,
incredibly, we touched on it earlier, inefficient.
yeah.
But actually, when you've got somebody, a team of trusted colleagues that have your back delivering that outside of it, that can really help drive business profitability, client experience, and team well-being. We all know how teams really suffered through COVID, and actually really is still that, there's a lag post-COVID still. And I think, as you say, all of these tools that can pull things together that just help little elements. No digital tool is ever going to be the fix.
Mm.
Like, the fix is the veterinary practice, and it's kind of like, it's kind of what bits
The
can we
constituent
use?
parts, isn't it?
Like the practice is the epicentric part that is very much the beating heart of what clients know.
Mm.
But it's what tools can we use to keep that practice at the epicenter? Like, how can I send my reminders? How can I do this? How can I do that? Do my clients even know about this? You and I are in Liverpool. There was a case yesterday, of two dogs that had eaten something and died very suddenly. And of
Yeah,
course, you see it on the news. But actually, for clients to have the ability to communicate immediately to their client base in that area, guys, just so you know, this has been made aware to us. This is the symptoms that you're looking out for. These are what you want to be
yeah,
aware of. Like, it's a huge step forward for us as a
yeah,
profession. If you've got a concern, we're here. If you can't get through to us on the phone, use VidiVet. If you can't do that, then, if we haven't, there's tools that you can use. Use PetsApp, use
yeah.
Digital Practice, use our Facebook Messenger. Like, there's tools that everyone can pull together, and it's some put burden on the in-house team, some send stuck people. That's, there's a way that all practices can utilize what we've, you'll be aware that in business, we in the tech world, we talk about our tech stack, and we very much talk about our vet stack. Like, what is my veterinary business is my stack of services, and that goes right the way through from, my wholesaler through to my PMS, right through to what peripheral services am I using, to keep me in the loop so that I can support my clients as best as I can. And
Mm.
clients talk more now than they ever have. I mean, we've got I'm a part of a few different groups purely out of curiosity to see how people communicate, and the practices do stuff well. They're revered. You know, like as soon as somebody asks something like, "Go to this practice," why? Because they do this, 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 and this for us. And those are the practices that will really thrive and succeed in the future.
Yeah.
Um,
Well, you have to be a digital business, I think, is, if you're
100%.
not a digital business, maybe you haven't survived COVID, but you're not going to keep up if you're not taking these things on. Just moving a little bit, because we're talking a lot about, whether practice is really needed because there's an emergency or, you're triaging the stuff that, isn't that urgent anyway. Um, Obviously, looking at digitalization, and I think we mentioned it around sending out reminders and things, that whole area of the pet health plan, I think, is also going to be affected by this as well, because with my sustainability hat on and also with my hand up saying I am sorry, as a dermatologist, I was very keen on making sure everybody had flea treatment, and we know now that some of these products are ending up in rivers, causing issues around sustainability. I actually did the first, as far as I'm aware, the first pet health plan in the UK in 1999. That Julian Wells's practice was kind of first, but I got mine. I sold my first policy. He was before me, and then I moved quickly and sold one. And one of our favourite lecturers, Mike Willard, um, with that beautiful Texan drawl that he has, he used to say, all of everything I taught you 10 years ago was a lie. I just didn't realise. So again, that sort of pet health plan almost needs to develop with things like VidiVet, maybe as a service, but also more diagnostics around, well, don't treat for fleas unless they're there, unless you've got a really allergic dog or cat. And similarly, maybe you don't need to worm. Let's do a fecal egg count before we push on and give you some, worming tablets and the like.
Yeah, I mean, I think the pet health plan realistically hasn't evolved for 20 years, and look, that's
Mm,
until now it really hasn't been a problem. It's been sort of something that's there for practices, but I think we're starting to see the evolution of even health plan only practices.
exactly.
Practices that unless you are a member of our plan, then you're not. There's other vets available. Sort of mentality. You look at garden vets. You look at
I've got to give a shout out to Village Vets.
you beat me to it. So yeah, Village Vets, a shout out. You look at Village Vets, you look at Walton Vets. We'll put the Scousers up there.
Yeah,
And there's what is it? Pickles in London, and
yeah,
there's evidence now. There was one that tried it a while ago that didn't succeed. And I think when you're doing a policy only practice, you've got to really look at your local demographic.
yeah.
Is it the right place to have this practice? Personally, I think there's a lot of practices that are doing the right thing at the minute, because I think if you're opening a practice, it's easy to start as health plan only. But if you've got an existing client base, it's very difficult to then turn around and go, right, guys, we're now a health plan only practice.
Yeah.
So people are easing people across that. But traditionally, of course, health plans were kind of product based and
Mm,
discount based. But the last I checked, really neutering, unless you've done something monumentally wrong, is a once in a lifetime discount. Dentals are something that are used sporadically. So there were kind of things that were there, but we didn't necessarily want people to use. But it was like, if you're on this, you're saving this in theory. And of course, you talk about the flea and wormers. I think they will remain a mainstay for the while, but it's good to see how the products are evolving.
mm,
Um, and again, you look at that from a sustainability point of view. It's great to see that they are considering how we provision these for
mm.
practices. But as you rightly point out, one great example of AI is, the likes of the Zoetis Imagist. I know IDEX have got some cool stuff in terms of their diagnostic in-house AI tools. And of course, what that means for us as clinicians, client turns up to a 6-month health check, brings a fecal sample, we can run something through. I think by the time that consult is finished, we've got a result.
Yeah.
And that efficiency, rather than sending something away to the lab and waiting 2 days for a result and then having to get the client back, you've got great services like our vet shop that have home delivery. You've got all of these buying groups that have got home delivery as part of their health plans. Merlin Vet Cell, Covetrus, that everyone's doing it. And that's great because it's reducing the carbon footprint of our veterinary
Mm.
experience while still keeping the practice at the epicenter. You'll notice a recurring theme. But for me, it's like, how can we evolve our practices from just being product based to being product and service based? So you're starting to see practices including all of their consultations. And one really interesting use case we've found is that because people are using all inclusive consultations, understandably, the team's concern is, well, everyone's just going to come in all of the time, and actually, it will be non revenue generating consultations. So, quite a few practices have been using VidiVet as that pre consult screen. Does this need to come in? Is this
Mm.
a warranted physical consult? So that when I come in,
Yeah.
I know that my consultation is going to be revenue generating. Will the client
Mm.
turn up with a fecal sample? Will they turn up with a urine sample? Things that I can do there and then and give them an instant report. I've got a dog that's slightly off at
Mm.
7 years old, and digitally their advice, yeah, do you know what? Bring in a urine sample with you. We can do a dipstick while you're here, and then
Mm.
we can decide on the basis of that what we need to do further. Clients, it's really interesting. If you charge them for a consult, and they leave and your pet's fine, there's almost a begrudging of paying for something.
Yeah.
Whereas actually, if you go, well, I tell you what, your consult's free, but you're paying the same as you would have paid for a consult for a dipstick. There's this, the vet did this, and that's given me peace of mind because I've literally seen that
Yeah.
something is okay with my pet. It's a fascinating psychology. And for me, the health plan is growing in importance because, especially in those traditionally quiet months for the practice, where we've got that revenue guaranteed coming in. And you're seeing practices that have kind of, our UK average is around 25-30% at the minute. Practices have really got this thing at the moment of we want to drive up to 50% of our client
Mm.
base. Some practices, VillageVets as an example, are pretty much 100% health plan practices. And that works, it works as a model. But I think, practice have to decide their own philosophy on what they're wanting to do. But as we say, that evolution of the plan to involve more and more service
Mm.
is very much on the rise. I mean, we've got over 100 clinics using VidiVet as part of their health plans now, because it's a value add. They can now
Yeah.
turn around and say, well, look, we're adding in a service that's worth over £100 a year into our plan. Therefore, your plan savings aren't £200. They're £300 a year.
Mm.
You saw Vets for Pets, they've included their 24/7 phone line service as part of their health plan. And again, it's all just little touches that is, if you're going to bring about a price increase in your plan, your churn rate is going to be lower when you're not just taking the price up, but taking the price up at the introduction of a new product. You're going to reduce that opportunity for churn from your plan because there's stuff that they get here that they don't get elsewhere. And again, it's all
Mm.
provided by their practice, so the clients are grateful to
As
us in
as you
experience.
said, is bringing the practice very
Yeah,
much into the center where obviously a lot of people, we sometimes worry that we're not liked by clients, but consistently, trust wise, the trust categories, pharmacists,
yeah,
opticians, vets are right there at the top, politicians somewhat lower.
yeah. To say the least, practices are loved, and the amount of reviews that we see through practices. Again, Vet Help Direct, prime example. This positivity around practices.
Yeah,
I think we very much focus on the doom and gloom as a profession. And look,
yeah.
times are dark across the globe, not just in the veterinary world. But actually, we are for 99%. Yeah, there's the one client every now and then that you just think, you've ruined my year. You alone have ruined my year. But 99% of our clients love us, adore us, and value us. And that is the
Mm.
critical word. Like, they value us, they value our expertise, they value our time, they value our insight. Yeah, of course they begrudge a bill, but who doesn't?
Mm.
I had to have my wife's car repaired, and I love my mechanic. He's done wonders with our car. It's 14 years old now. But equally, you do look at it and think, well, I'm still begrudged to hand you 500 quid.
Mm.
That's just the nature of
Yeah.
commercial society. But of course, if you can roll as many of those costs into a monthly provision, then it makes that individual hit every now and then much more sort of nullified.
Palatable.
Well, digital stuff is one of the biggest reasons that people have stayed stuck to their insurance companies, because, oh, well, I value this service from my insurance company. Um, there's no reason that vet practices can't do the same to add to that stickiness of the clinic. And it is all about how can I make my clinic ultra sticky to every single client that I have. And as I said earlier, no one tool will do that. You as a clinic and your global provision for your clients, that's what does that.
Ben, I thought we would chat for a while and not have a problem with the conversation. I'm conscious we're 30 minutes in. We could talk at least for another half an hour, which will mean that it will probably be close to midnight when we get to Spibs. So I am going to let you go, but thank you so much. I think it's really interesting how the market and how the veterinary profession is evolving, becoming more digital, becoming, should we say, a little less conservative in the way it looks at things as well. So it's been great having you on as the founder of VetChat as well as VidiVet.
No, thank you very much for having me. As I say, it's exciting. I'm sure we can continue our chat at Spivs at the bar.
Exactly. Good man. Great to see you, Ben. And who knows, we might even talk about football as well.
Yeah, not as an Everton fan.
Good to speak to you, Ben. Thanks everyone for listening. Hopefully see you on a podcast or a webinar very soon. This has been VetChat from the Webinar Vet. Take care. Bye-bye.
Bye.